Hello, Richard Stewart again. Um, I again, I have I've been a nurse in nursing since 1996, and I started this channel just to talk about healthcare and other issues here in our country in America. Um, so, one issue, the issue I want to talk to today about is just the issue of medical insurance, really, and how it's and who's at fault for the high cost of healthcare. Really, um, I'm by no means an expert in statistics or anything like that. All I can speak from is my experience and from what I see from other people and from my friends and family, and so I'm going to kind of speak on that on my circle. Um, in my case, um, you know, my wife and I we had medical insurance with United Healthcare um, last year, and we had a private plan, so we didn't have it through an employer. I got it. I paid went through the health through the marketplace, healthcare.gov, and I always thought, okay, that's that's where you go if you want a special rate or if you want a good price. No, it's not. I was just disappointed. That's where I had to go because I wasn't working for anybody at the time. But I ended up just for her and I ended up paying like $700 a month for both her and I, and they kept telling me that was a great deal, you know. So here we are paying almost 700 a month for we got dental with that, and it seemed like every time that not only was there a deductible for me, but there was also a family deductible. So even though I met my deductible, um, she would go and not get covered because she hasn't met the family deductible. So I've got basically two deductibles, even though she's on my plan. You know, so it was like 4,000 for me and like 7,000 for her, something like that. So just about every time we had procedures done, either they wouldn't pay or they wouldn't pay that much. And last year, with doing with that, I had to write it off on my taxes because it was so much of our income. I mean, we spent a lot out of pocket, you know, um, and just the fact of, and here's the stuff that we came across. For instance, um, my wife was having dizzy spells, and I took her to the emergency room. They didn't start an IV or anything like that, but they did do a CAT scan. Now, we were told that if we would go to that particular hospital, that they would pay for the CAT scan, or they would pay a big chunk of it. Well, without insurance, because I asked for an itemized bill at the end of this thing, and just for her going to the emergency room and getting a CAT scan was $65,000 that the hospital um, sent insurance. Like that's what they. So it was the provider that set the price, not the insurance company. And that's one thing I've been looking at because I've been calling my insurance company a lot more in these last 2 years, and I'm finding out everybody's trying to demonize the insurance companies, but they don't understand that it's the providers that are setting the prices. And insurance goes, well, we'll pay this or not. This is what we're going to pay, and that's it. But $65,000 for a CAT scan and no IV, no medicine, nothing like that. I mean, crazy. Imagine if somebody didn't have insurance. How much? 60 for one, didn't even admit her. Just one a year. It's just crazy. It's crazy. And I don't know what you guys are experiencing, but I, I mean, not only the insurance companies not paying what they should, because in this case they were supposed to pay for the MRI and they didn't pay that much on it. And I mean, I could go on and on about this, but I just wanted to know what you guys think. What are y'all experiencing as far as um, you know your insurance covering or not covering? How much the hospital is charging you, and how much these providers are charging? Um, it's to me it's just not right. You pay a premium every month, right? A couple $100 a month. Then you go to your provider. Then you have to pay out of pocket for the copay, and then you have to pay for what insurance doesn't pay the provider, like whatever cost that is. So you're why should you pay a premium every month and break yourself and go out of pocket also for things they do? It's like, why are you paying a premium? Why are you paying a premium? I mean, it's this medical system is breaking people, and the money that they spend, they're having to, go bankrupt on paying medical bills. Whether I mean, I don't care if you got the best insurance plan in the world. It just seems that the reason it's not being taken care of, the reason people are still having to pay out the butt for medical care, even if they have insurance, is because the people that are supposed to be overseeing all this in our government are getting everything for free. They're getting their health care for free. They don't have to pay they don't have to pay out of pocket that much money every month. They don't have to do that. And when you're in a position like that, what's the motivation for helping the general public? For helping them not let the medical system break them? I just want thoughts on this. Thank you.